Heather, we're here on the 9th floor. The 9th floor is a med-surg bed unit. The hospital is set up in really two towers, so we have a west tower and an east tower. Each floor is 24 beds, so those 24 beds wrap around the perimeter, so all of those private rooms are on the exterior of the building. When we come out of the elevator lobby, the main elevator lobby, that is the main public elevators, so the public will be coming off of those elevators and then to this intersection, where at this intersection we have architectural features in the ceiling, and we'll do architectural detailing on the floor so that it helps and assists with wayfinding. Behind that wall we have the family waiting lounge, and that lounge has the kitchen area, television area, and then surrounding it there are other support areas that are vending, laundry, and other respite types of locations that exist then in support of the families and the visitors. At this point, the diagonal corridors then take you into the main entry into each unit. So this direction would take us to the east tower, and this direction would take us to the west tower. Currently, the west tower has the most construction that has been completed, so we're going to take you into that location and tour you through that particular bed unit. Okay. This corridor will all be open here, and then there'll be digital wall covering that's on the walls here at this location before this security door into the unit. And this digital wall covering has images that relate to our ecosystems and the themes that we've developed for each floor and each level in the hospital. So the security doors here provide security not only here but the entire perimeter of the unit. So the stairwells are locked down and other egress locations are locked down. Will require a badge and an authorization both for entry into the unit and exit out of the units. Patient rooms then start along this side here. Outside of each of the two rooms we have a decentralized nurses station. As you come into the unit then at this point, this location is the communication desk where that we have the central desk that will greet and assist visitors and patients whenever they first arrive. On the corner here we have a playroom. So we have two playrooms on this particular floor located on opposite corners. This particular communication station, the 24 beds are subdivided into two 12-bed types of pods. Around that then are other support functions like a med prep room, physician rounding room, staff support areas, nutrition room, those types of things then that support these 12 beds. Here's a good example of a patient room. The first tenant primer that's going on the wall here that begins to give you a feel for the type of design and color that'll be in the room. With the private rooms, we also have a private bathroom with a shower. So this is the med prep room for this 12 beds. So the med prep rooms have been configured so that the layout inside of the room is the same for every med prep room. So whenever you enter the room, you have a consistent layout of casework and equipment that exists inside of the room. This is the staff lounge locker area. So this side here is the locker area, so we'll have lockers in this space. There's two bathrooms here, one with a shower, one's just a toilet and lavatory here. And then connected in then to the actual lounge area for the staff. And that brings us back to where we started.